Hi everyone, you have entered Encouragement on Fire. Today is, I believe, December the 11th, and we are going to talk about health equity. Not in probably the terms that you're normally used to talking about it, but we're going to talk about like a tiny little portion of it. So I believe that, with health equity, we have to have partnerships within the community. And many times, when we are in our own journey, there's all these different silos, different things. You have your health hospitals, you have your, health insurance, you have your individual groups, in the community, you have your friends and family. Well, all of them are important when we are talking about health equity. And even though I am not an expert on it, I've just been gathering some information to possibly help you, because you have chosen to listen today or to view. And I thought this might be some really good information for you. So what I like to do is I always like to get an article that's based on research, or an article that's based on someone who is a doctor in the field, or they have research-based information. So we're going to start out with, there is actually an online, it's healthpartners.com. And I'm going to place this information in our Facebook group. But this particular one is Partners for Better Health Goals. So you can look that up. And it is based off the research of a professor, or Dr. David Kindig. And this is a professor of population health science at the University of Wisconsin. So kudos for, Dr. Kindig, for your information that is helping many individuals. And this particular health partner information is based on 20 years of purpose to improve healthcare. So even though it's not this particular research, or this particular partner is not the only one, so keep that in mind, it's not the only one. We're just talking about the specific one. So wherever you are, whatever state you are in, make sure that you are looking up information for your particular state, because they always have valuable information for your particular state, as well as programs based on the needs of your state. So this particular information, his studies, it says, and comes straight from the website, his studies show that a person's health is determined more by lifestyle and social and economic factors than by the health care they receive. So a lot of times when we're talking with, other people, sometimes people are saying, well, if I had health insurance, or I had these different things, that my health would be better, and that may be the case. However, there is more on the table. There is more at stake. So if you are an individual who's never had health care, does health care help us? Absolutely. However, we can still eat better. We can still exercise. There are other things that we can do. And according to this professor, we have an obligation to our own health to not put it on just our healthcare system or our insurance. We have a responsibility to ourselves to make sure we're doing our part. And I agree with that. We have to make sure that it's not just we're all blaming it on, well, they're not doing this for me, or they haven't done that for me. Well, what are we doing to take back our health, right? I think that's really important. What are we doing? It's everyone doing their part. So this particular healthpartners.com, their goals, so they make goals, whether it's every year or they make goals for the quarterly, maybe it's 3 years or 5 years. I really didn't go into it. But what they do is they go into making sure they're making goals and they try to meet them in a quick amount of time. So I can share with you a couple of the goals that they were doing. So one of them was they wanted to reduce disparities about breast cancer screenings. That's one. Okay, so we all know that, and that's my dog. We all know that individuals sometimes, when it comes to breast cancer screenings, there's been a lot of people that really did not want to, well, I'm not going to get my breast scanned, or I'm not going to do these things for whatever reasons. Sometimes it's the fear of what if it does happen. Well, if it has already happened, it really doesn't matter. Right? What matters is that you find out and then you get the help that you need. Maybe sometimes there's some myths or some things that people have told us about the experience. But if you don't go through the experience yourself, you really don't know. As many times I tell people, just Google it, YouTube it on, just find out the information before we say no to a thing. I just had Elder Cynthia just join me to the conversation. And Elder Cynthia, we're talking about, there's been some research done by David Kindig, and he's a professor from the University of Wisconsin. And this particular research was done on Partners for Health, Partners for Better Health Goals. And what they do is whether it's 2-5 years, they make goals in the community, making sure that whatever is going on, disparities, they're trying to conquer it. So the first one that they focused on was reducing disparities about breast cancer screenings. And a lot of people, and we were just talking about, some people resist getting breast cancer screenings for whatever reason. You being a senior, have you ever heard of individuals not wanting to get their, I'm not going for that? Is there any reasons they would say that? Because there has been a change, based on this. In 2009, they had, I think there was a, not for breast cancer, but I think it was a colon screening. There was an increase in African Americans getting more screenings because of not necessarily this particular organization and their goals, but an overall of maybe them and others of what they've been doing in the community. Mm-hmm. Trying to make sure they're getting out, telling people about, you need to do this, you need to do that. What has been your take on screenings, period, overall? I'm just being from a senior's point of view, has this always been welcomed? Has this always been or have you always done it, and why have you done it?
I did it because the doctor said have it done.
Because the doctor said have it done. Well, that's a really good reason. I'm just being honest, because they are the professionals, right? They are the experts. And if a doctor tells you should really have a screening, go and have the screening done. However, let me ask you something, and you can share, not the answer. When was your first breast cancer screening? How old were you when you first got your first one?
I don't know. It was years ago.
Okay, so let me ask you this. Were you a senior when you got it done?
No.
Okay. Were you in your 30s when you got it done? 40s?
Probably so.
In your 30s
Probably
when you first got it done?
Yeah.
Okay, so that's good. That's a really good, I'm glad to hear that, Mom, but that's really good. All right, so in your 30s, you're just starting to have it done. And I believe that is when they suggest for you to do that. So you were a good patient. Well, we had a great doctor. Our doctor, and I can say his name. He's deceased now, but Dr. Joseph Berger from Berlin, New Jersey. Wonderful, wonderful man, wonderful family. Mm-hmm. And he was my doctor, I think, from the day I was born. Yeah. And awesome, just an awesome doctor. And he was my children's doctor as well, I think up until they became older teenagers. But he was just a wonderful man, So it's good to have good doctors that tell you about the screenings so you can go and to get those screenings. Another one of Health Partners, the Partners for Better Health Goals, was more screening choices. Because I think a lot of times when we have the screenings, what type of screening are you doing? Let me say this. There are different types of screenings. We are not going to get into all the different types of screenings because I did not prepare for that. However, you should ask your doctor when you're in front of them, him or her, and say to them, I know that there's breast screenings I need to do. I know that there's colon screenings. I know there's these different types of screenings. Can you share with me the different types of screenings so then I can make a better decision for my health? That's what I would say to each and every one of you. Don't assume there's only one type. Don't assume that. So you should always ask, because there's new science. There's new things happening every day, things that are supposed to be better for the body. And if it's something, that you can do that over your overall health is better, go with that type of screening. Okay. The other one is reminders for screening. I think that's awesome, because once you've had a screening, you get, unless you have a specific type of doctor, because I know my doctor sends us reminders. You haven't had your screening. This is your season to have your screening. I can say this. If you have, Penn Medicine, if you have, South Jersey, those little apps that we have, Jefferson, they send you that, like in the actual app. There is something that says you are due for your annual colonoscopy. You have it every 5 years or whatever. You are due for your breast cancer screening. They are, and I believe most of the healthcare systems now have that in place. That is a wonderful thing, because I don't know about you, unless you have a group of individuals that you partner with. Now we do. That you partner with, you tend to, because of your day-to-day, you tend to forget, but I know that we have a group of women at our church that, whether they tell you if it's on your birthday, if you haven't had your screening, you go on your birthday. And that's what I do. I go during my birthday time. I'll go in and have my breast cancer screening. But then, like I said, what about you, Mom? How do you remember your mom's sitting over there laughing? She's always laughing.
I try to forget.
You try to forget, but the doctor, again, see, that's the thing. You have to have partnerships. And her partner is her doctor, letting her know. And also, we're going to tell her too, but her doctor is her main partner, saying you should do this. Now, does your healthcare, do they I don't know if you have Medicare.
It's always been the doctor's office.
But it's always been the doctor's office. Medicare doesn't reach out to you and remind you?
I don't think so.
Well, maybe some of our listeners, if they remind you, you can put it in the post and let us know if they if you are on the system and they actually remind you about it. But if you have your doctor, your family, if it's your group, like we have our groups together, getting over the health matter that I recently had. I have a group of women that have gone through the same thing, and a few men. We remind each other, okay, it's time for you to go for make sure you're doing your annual checkup, or you're doing that. Now, I'm still in the process of every 3 months getting my checkup. But there's some people who have graduated to the 6 month, and then there's some that will graduate to the year. So you could be in different stages of that. And then I think after the year, it goes to 2 years if they haven't seen anything. So just be mindful of that. All right. So based on healthpartners.com, they're talking about what determines health. There's a few things that they talked about. And they did say that 20% is based on your health care. So what type of health care? Like Elder Cynthia said, hey, my doctor is constantly telling me about my screenings. So if you are going to your doctor, hopefully many of you, or if you have insurance, you're taking advantage of it. There are many people who do not have insurance. And I don't think it's because they don't want insurance, because they are not able to. So if you are able to have insurance, there was many years I had insurance. And guess what? I wasn't even going to the doctor, getting that annual checkup. And I think that's, it's almost like a disservice to yourself. you really should be getting checked up, finding out, is there anything I need to improve? So I encourage everyone that's listening, if you haven't seen the doctor in a while, this may be a great opportunity, the holiday season, or, New Year's, some people do New Year's resolutions. Go and talk to your doctor and see where you are. Get that blood work done. Find out about your nutrition, based on your blood, where everything is, your levels, find out, start that year, just making goals that I'm going to be healthy or healthier, because some of you are extremely healthy, but you know what? We can always improve on where we are. Mm-hmm. So I'm just encouraging you to do that. That's why it's encouragement on fire, right? So, and also some of the different websites I'm always pushing out there, the CDC, they have something on advancing health equity and chronic disease prevention and management. Take a look at it. Some really good information. And then every state, like I was saying earlier, state to state, whether you are New Jersey, Philadelphia, New York, some of you individuals out there, look up and type in the Google and say healthy, and then the abbreviations to yourself. So if it was our state, healthy NJ, if you was, or healthy PA, those type of things. And then you might want to put equity in there. They have some great information. Okay, I'm encouraging you. While you're sitting there, they have it on minority health data, communities in action pathways, things of that nature. There's all these programs. If you can't get something because you just don't have the money for it, there are programs set up in every state. Hopefully in your county it's available. But if it's not, there may be accessibility in a different county in your state. Because it's not in your county, you can get that service. You see? So I'm just saying it may be available to you. We're always talking about access. Well, this is an opportunity. Go on there and find out, you know what? I do need information about this or I need information about nutrition, or I need information about that. And then you can get that free service because there's a lot of free services available. And as we uncover some of services, we will mention them to you. I want to direct you specifically to typing in health equity and your state. Also, I wanted to mention some other things that healthpartners.com had mentioned. And they said 40% of our health is determined by social and economic factors, such as income, education, employment. We all know that if you've ever suffered in any of those areas, and I'm just being honest with you, if you've ever suffered in having lack of income, or some people are not privy to go to get education to help them. And that could be university, may not be. It may be technical school. It could be an apprenticeship, whatever it is you need based on your purpose in life, and you're unable to do it. It does hinder you in getting the best health care for yourself. And health care is a big word. Sometimes like I said, we say, our medical insurance. Health care is so much more than that. And then they said 30% is health habits, such as tobacco and alcohol use, diet and exercise, and unsafe sex. All of these things are important. We can't go into all of them. But we know anytime we put a foreign substance in our bodies, it's going to affect us. And that's why they want you to make sure that you are doing things occasionally and not something like habitual, like it's all the time. You have to be careful with that. Anything in excess, if you're my faith-based believers, anything in excess we consider a sin. Mm-hmm. So you want to be mindful, got to have that balance, no false balances. And then diet and exercise. I am totally guilty of that, but diet and exercise, that has to be something that's on our minds all the time. Whenever we're about to put something in our mouth, like right now, I have a nice glass of water. Water is good, right? It's delicious and good. So I want to encourage you, make sure you're drinking enough water, okay? I know a lot of times we like our sodas, we like all these different things. And I'm not saying that you shouldn't have them. What I'm saying is that those should be things that we do occasionally, not every day. Okay. I had some, I won't say who, but I had some relatives who are no longer with us, and they drank soda every day. Every day. And in my opinion, remember, it's only my opinion. It's not something in stone. That's not good. That's not a good thing, drinking soda every day. And I think the statistics, if I went and looked it up, it would support that. So we want to make sure that we're putting those things that are healthy. Now, I can honestly say to you, statistically, water is good and we should be drinking it. If you go to your doctor, what is your doctor going to tell you? Drink your fluids, your water, and make sure you are exercising. And they'll tell you fruits and vegetables. See, we can say those things. We can tell you those things are good, not only because our doctors say that, but because we do them and it makes us feel better. Also, let's see. And if in unsafe sex, be careful. Be out there. You know what the research says. So just making sure you're mindful about the choices that you're making in that. And that's all I'm going to say about that. So they also said 10% environment, including urban design, clean air, and water, like we were saying. So if you're going to drink your water, actually this water, there is a filter that I have inside of my refrigerator as well as on my refrigerator. And it's actually time for me to change it. So I got to go on down there today or tomorrow and change it out to make sure that the water is being filtered. But if you don't have the opportunity for something like that in your refrigerator or on your refrigerator, there is a way that you can do that through by buying, I believe it's charcoal. You can buy the charcoal drops, putting them inside of your water to make them the water better. So just look into that, because this is not the topic for that today. I'm aware that that's something you can do. All right. And the reason that I wanted to group these different things together from that article was because I wanted to get to this point. In 2018, the county health rankings in New Jersey. I want to start with New Jersey because we're in New Jersey, but I'm encouraging you. Okay, I'm encouraging you to, like I said, type in health equity and your abbreviation for your state. And then I want you to look up the rankings for your county. That is important. I was shocked when I read about New Jersey. And even though this is the current ranking, well, since 2018, that doesn't mean that me individually and my family are subject to that ranking. What we need to do is we need to better our individual health and try to do what we can. And I encourage all of you, when you're reading that or looking at your information for your states. So let me tell you, let me just share. And like I said, it's real brief. It says differences in health outcomes within states by place and racial ethnic groups. So if you're out there, you're being represented in this entire thing. And how it's measured is health outcomes in the county health rankings represents measure of how long people live and how healthy people feel. So those are the two things they're measuring. How long someone's living. So mom, you been living a long time. Grandma lived a long time. Uncle Alan lived a long time, right? And then how do you feel?
I feel good.
I see mom saying, I feel good. My mom go to the gym 3-4 times a week. I feel bad because I'm like, I don't do none of that, right? But I'm getting there. I'm working on it, you know? But that's how they're measuring, the county health rankings. And then these are some of the factors that they're going to go into detail. So when you look this up, poverty, health, they're going to discuss racial disparities and education. So all of this is on a percentage base, and they're talking about all of these different factors. It's really interesting. So I encourage you to look it up. Now, this is what I found out. They ranked this from 1 to 21 in counties. So in New Jersey, Mom, these are our counties listed from 1 to 21. Guess who are the top 5? Think about that. Aren't you curious? If you are in New Jersey, aren't you curious? If you're in your state, aren't you curious where your county rates in the rankings of being healthy? I wanted to know as soon as I was like, okay, where are we at? And they color coordinated, so I had to really look and go through it.
New Jersey.
No, well, that's what I'm saying. In New Jersey, out of all the counties, they're going to do it. So the first 5, Sussex County, Morris County, Hunterdon County, Somerset County, and Bergen County are our top 5 in high ranking for healthy.
That's good.
That's excellent. So kudos to y'all. You actually must be doing something good. But remember, it's not just based on health. It's based on poverty. It's based on health, racial disparities, and education. And there's some other factors in there as well. I just want you to be mindful that this is real. And this is how you get funding for your counties and different things of that nature. Now, let me tell you who was the final 17 to 21. Okay. 17 to 20. Look, we're in there. So I'm just putting it out there. I didn't do the middle, but I wanted to tell you who was the last few. Camden County, Atlantic. Now, I just want you to know, listen, we're talking about New Jersey counties.
New Jersey.
Okay. Camden, Atlantic, Salem, Cumberland, and Essex. So in healthy county list, we are the 17 to 21. That means there's some work we have to do. That means that all of us, and I always say it's a collective thing, but it's also an individual thing. Because if we're all working on what we need to work on individually, eventually as a group, those things will change. But there are levels to it. So we can do our part as individuals, but then there are levels that we have to, as groups in the community, work together and to eliminate, those disparities by working together and making the changes in our health. And then we have all of those wonderful things that the healthcare, the hospitals are doing. They have programs set up to assist people who may not have the money or may not have certain things. Take advantage of it. All these things. Sometimes we live in these silos and we think no one is doing anything for anyone. Well, that's not true. There are a lot of programs. There is lots of funding out there. There's lots of things that is being done. However, do we still have to do more? Absolutely. There's always more to be done. But I'm learning, instead of complaining about what's not being done, look at what is being done. Celebrate we have these things being done in our state, our county. And then looking at it and saying, okay, so we can still work on these things. So what can I do? How can I partner? How can I help to be able to make a difference? Maybe not for me, maybe for other people in my community that are still suffering or are still, not receiving care. What can we do individually and collectively in our community? So those are things I wanted to share with you. We all have to have some common goals for our own individual lives. We have common goals for our family. We have common goals for our friends that we collectively remind for, the screenings that we need to do. But how can we also work with our health organizations, our hospitals, partnering with them in the community? Sometimes you don't have to do a lot. Sometimes maybe just volunteer for some of the services or the things that they're doing in the community, maybe once a year or twice a year, because now it's not only helping you, but it's helping someone else. Okay? So this is Shirley Farrar, and I had Elder Cynthia with me today. This is Encouragement on Fire. So I hope you are getting excited about partnering, maybe outside of yourself, but also partnering to help you and your family and your local community, and hopefully New Jersey, or if you live in New Jersey, or your state that you live in. Okay? All right, so I will talk to you soon. Again, Encouragement on Fire. Have a good day. Bye-bye.